2021, the Head and Neck video series, our Cancer Forum, is looking specifically at dental issues. Now, last year in 2020, we did interview Associate Professor Sharon Liberali, a special needs dentist working in Adelaide, and also a very experienced ear, nose and throat nurse called Tracy Nichols, who works out of Flinders Medical Centre in Adelaide and is the South Australian coordinator for head and neck cancer patients. And we spoke to her about dental issues for head and neck cancer patients. So we have done it before, but for 2021, what's different is we're just talking to people about dental. And the reason is that there's a glaring need for more help for head and neck cancer patients before, during and after treatment, but particularly after treatment. If we're lucky enough to survive for a long time, there are big dental issues. And it's just something that there isn't much awareness about, I think, in the dental community. And there isn't much awareness about in the patient community. But some special needs dentists and some ear, nose and throat surgeons in particular, and radiation oncologists, they know there's a glaring need. So we're trying to raise awareness and make positive suggestions about what more could be done for head and neck cancer patients. Look, I was surprised to discover that dentistry was absolutely critical to me as a head and neck cancer patient, and particularly to my recovery. And the reason it's so important is that there's three kinds of treatment that cancer patients get, and every head and neck cancer patient is different. But the three things that many of us have is surgery, radiation therapy, and chemotherapy. Sometimes the surgery interferes with the salivary glands, which are in this area. Radiation therapy always interferes with the salivary glands when it's in this area. And the chemo has an effect on blood supply and quality of saliva as well. And to have a healthy mouth and to have healthy teeth, you have to have good saliva. And so the impact on the saliva means we're much more susceptible to caries or problem damage to our teeth, holes in our teeth, and also to bacterial infections and fungal infections, because our saliva is either not there or it's damaged or it's different. And it means that for the rest of our lives, we have to engage in a really diligent cleaning process and use a lot of fluoride, either self-applied or professionally applied or both. And, this is a huge issue because the mouth wasn't included in Medicare when we got our public health system in Australia. And so many people don't go to the dentist. And in our interviews this year, we'll hear from a surgeon and two special needs dentists and a nurse who works with head and neck cancer patients all the time about the fact that many patients have 4, 5, 6, or even more teeth extracted before they have their treatment for head and neck cancer, because a decision is made in conversation with the patient that there's very little chance that those teeth will survive the treatment process well enough, or there's a decision made the patient is unlikely to be able to afford dentistry or to diligently go to the dentist. And after we've been treated, it's very dangerous to have an extraction. And that's explained in the videos why that's so. And so a lot of extractions happen before treatment. And, that was a very shocking thing to me as as I say, as a dentist's daughter, the thought that people were having 5, 6, 7, 10 or more extractions, it was a shocking thing. It frightened me. And I promised myself that if I recovered from this illness, I'd try and learn more about why this was necessary and work with patients and doctors and team members to try and get better dental support for head and neck cancer patients. The harsh reality is, and you're going to hear it in one of our interviews with a working dentist and a visiting dental officer who's worked with 3 cancer centres in Sydney for 27 years. The harsh reality is that many patients simply cannot afford the quantity and quality of dental care that is essential for them to look after their teeth after treatment for cancer in the mouth and in other parts of the head and neck region. So they fall through the cracks because they're not rich, they're poor. Some people, of course, have private health insurance. I fall into that category, but I can tell you that the gap between what I get reimbursed from my private health insurer and the actual bill I get from the 3 different types of dentists who I see regularly now since treatment, that gap is big. And so even for the privately insured patient, it's an economic burden. And of course, there's this big group in the middle. They don't qualify for public dentistry because you've got to essentially have the health card, be on a pension of some kind. So if you don't qualify for public dentistry and you can't afford private insurance, or the gap between what you get back from your insurer and what it costs, you're in really bad trouble. And you'll hear in the interviews we've done this year the sort of really desperate situations many head and neck cancer patients get into with their teeth because they can't afford dental care. There's one other thing too that is a not uncommon side effect of either surgery or radiation for head and neck cancer, and it's a thing called trismus. Trismus, I'd never heard of it, but basically you can't open your mouth very wide, and they try to get onto it really soon, and people put like flat sticks, like paddle pop sticks in their mouth and try to get their mouth to open wider. But some people just can't open their mouth widely enough to get proper cleaning and so on. So there's a whole range of reasons why you're in trouble around dentistry after head and neck cancer treatment. There is a sense of optimism about the new treatments that have been developed and are continuing to be developed. And that's a terribly important point to emphasise, because over the last 10 to 15 years, radiation therapy has become increasingly precise, and thus there is much less collateral damage to the healthy tissue than there used to be. But of course, so that's good news. And so particularly if your head and neck cancer is caused by the human papillomavirus, HPV, and that's the sort of tumour that I had, we respond better to treatment, and we tend to come from a higher socioeconomic group, and we tend to have a history of going regularly to the dentist. So we come to the need for treatment more dentally fit, is the language you'll hear in the videos. However, in the past, up until relatively recently, the vast majority of head and neck cancers in this area were caused by smoking or heavy drinking, or even more troubling, both. And those people tend to come from poorer backgrounds because they're the group that are still smoking heavily and drinking heavily predominantly. And many of them don't have a treating dentist. They don't even always have a regular GP, and they're much more vulnerable to the kind of really serious dental problems which can emerge. So while there is optimism that the radiation is more targeted and more precise, and there is optimism that surgery, particularly the development of transoral robotic surgery, there are robots now that can go down through the mouth and do less damage here. But a lot of those robot surgery machines are in the private sector in Australia. They're starting to extend into the public sector now, but mostly in the private sector. So again, that body of patients who are predominantly the heavy smokers and heavy drinkers who have the greater challenges dentally tend not to have access to that surgical option, which can do less damage. So there is optimism, but there is a really urgent need, and you'll hear it said particularly by Associate Professor Richard Gallagher, who's an ear, nose and throat doctor working exclusively now with head and neck cancer patients. And he just passionately puts the case that we need special provision under Medicare so that head and neck cancer patients can get publicly funded dentistry, because the damage is caused by their cancer and the treatment for the cancer. And therefore, the essential dental work should also be covered by Medicare. And that's the fundamental message of this 2021 series of head and neck cancer videos. And we've endeavoured to bring to you a cluster of team members from cancer teams who work with head and neck cancer patients every day of the week to share with you and health decision makers, ministers of health, clinical leaders in dentistry and in medicine. We're sharing with you the information, and it's really a plea to say, help us get the access to public dentistry, publicly funded dentistry, that these vulnerable cancer patients deserve. You know, one of the things that really surprised me and brought home to me just how urgent this issue of dental care for head and neck cancer patients is that in the interview with ENT surgeon Associate Professor Richard Gallagher, who works at St Vincent's Public Hospital and private hospital in the Kinghorn Cancer Centre in Darlinghurst in Sydney, but he also works in regional New South Wales. And he has so many patients who need urgent access to have teeth extracted before they can have either their surgery or their radiation or both, because the teeth are so bad, as he calls them. So their oral hygiene and the state of their teeth is so poor, they simply have to be extracted prior to treatment. And that means that wound has to heal before they can be exposed to radiation. And so there's so many delays, and it's so complicated for him to get those public patients access to dentistry that is essential before treatment. He has worked with the dentist he works with at St Vincent's Hospital, and he's trained to extract teeth himself as a surgeon, and he takes those teeth out in order to provide this essential service in a timely fashion to give his patients the best chance of survival. I mean, that's marvellous that he's doing that. But the reality is, for rural and remote patients, and he's working with them as well, he travels out to Griffith and I think elsewhere. For rural and remote patients where there is a real lack of dentistry and dentists, they simply cannot get access to the same level of dental care. And as a result, if you have head and neck cancer, and you're in a rural or remote area of New South Wales or other parts of Australia, and you can't afford to travel into a city, have the accommodation and pay someone there to do your dental care, you get mass extractions prior to treatment. They even have what are called full mouth clearances. In other words, some people have all their teeth extracted before they're treated for head and neck cancer. And while I understand the practical need for that with individual patients, I believe that if we had publicly funded dentistry, particularly for people with this condition, but frankly for everyone in Australia, we simply would not need to do these full mouth clearances, because people's teeth would not be in such a bad state prior to the discovery of cancer. So, I have to say to you that when I first heard about full mouth clearances, all teeth extracted prior to treatment for head and neck cancer, I actually burst into tears. I just found it such a disturbing idea that was something that was considered necessary and acceptable. On this question of giving head and neck cancer survivors hope, I want to say that in our interview with Dr. Nick Andrews, a working dentist and a visiting dental officer, he runs through in a concise way the things we can do as patients to clean our teeth and maintain our oral health inside the mouth in order that we can minimise the likelihood of this long-term decline in the quality of our dental care and our dental condition. So I urge people watching this, have a look at that particular interview about, what we can do to look after our teeth as head and neck cancer patients, because, a lot of cancer team members know that we need to do more for the head and neck cancer patient, and I'm confident we will see progress in this area. But in the meantime, we as patients have to do everything we can to look after ourselves.